Good afternoon, and thank you for joining us for today's webinar, which will discuss the application requirements for the Second Chance Act Reentry Program for adults with co-occurring substance abuse and mental disorders grant program, administered by the Bureau of Justice Assistance. My name is Sarah Wurzberg, and I am a Grantee Technical Assistance Manager for Behavioral Health at the Council of State Governments Justice Center, which provides training and technical assistance to all grantees funded under the Federal Second Chance Act. Before I begin, we wanted to add a couple of technical notes. If you encounter a connection or audio problem during the webinar, please call WebEx for technical support at 1-866-229-3239. We'll also put that number in the chat box on your screen. Unfortunately, there are some connection issues we will not be able to resolve during the webinar. However, we are recording today's webinar, and everyone who is registered for the webinar will receive an email as soon as the webinar is available on our website, csgjusticecenter.org/NRRC. We should have the webinar posted online early next week. At the end of today's webinar, we will have a few minutes for questions and answers from the audience. To ask a question, please enter it in the question and answer panel or the Q&A panel on the bottom right-hand corner of your screen. You can ask questions at any point during the webinar, and we will do our best to answer as many as possible before we end at 3:30 p.m. Eastern Time today. Our primary speaker today is Maria Fryer, who is a policy advisor for substance abuse and mental health at the Bureau of Justice Assistance in the U.S. Department of Justice. Maria oversees the Substance Abuse and Mental Health on behalf of BJA's Policy Office. We are grateful to have Maria here today to lead the webinar. So today we'll be speaking about, begin with an overview of the Second Chance Act and the grant program. Then we'll talk specifically about Section 201, Adults with Co-occurring Substance Abuse and Mental Disorders, which is the section of the Second Chance Act where this grant program is listed. And then we'll leave some time for questions and answers. So the Council of State Governments Justice Center is a national nonprofit organization that serves policymakers at the local, state, and federal levels from all three branches of government. Staff provides practical, nonpartisan, and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. The Council of State Governments is also the training and technical assistance provider for the Second Chance Act grant. Through this, we are funded to start the National Reentry Resource Center. The National Reentry Resource Center, or the NRRC, has provided technical assistance to over 600 Second Chance Act grantees, including 40 state corrections agencies. We also have a newsletter that provides updates to the reentry field on what's going on. You can see the link on the right to subscribe to the newsletter to get information, such as information on Second Chance Act solicitations release. The Second Chance Act grant was signed into law in April 2008. For 2015 and 2016, $136 million was authorized to these programs to provide services. The purpose is to help states reduce recidivism and increase public safety. Currently, there are several other solicitations in addition to the reentry program for adults with co-occurring substance abuse and mental disorders that are out. There is a fiscal year 16 solicitation for a comprehensive community-based adult reentry mentoring program. There's also one for SMART supervision and technology and career training. For fiscal year 16, $68 million was appropriated for these grants. For the co-occurring disorders grant program specifically, it has been going since fiscal year 2010, and as you can see, there has been varying amounts awarded per year for this grant program, from 9 grants in fiscal year 12 to 18 grants in fiscal year 2010. Nearly $37 million has been awarded to this grant program, and 83 total grantees have been awarded. For fiscal year 16, in the solicitation, it indicated up to 8 awards for $5.2 million. However, please note that these are actually estimates and not necessarily the precise dollar amount that is awarded. So as you can see here, the 83 total awards that have been awarded include 60 county grantees, 18 state grantees, as well as five grantees focused on juvenile reentry. This includes individuals from 29 different states who have been awarded co-occurring disorder grants over the course of the past 6 years. So with that, I'm going to pass it to Maria Fryer to talk a little bit more about the Bureau of Justice Assistance and get into the specifics of the solicitation requirements for the Second Chance Act Reentry Program for adults with co-occurring substance use and mental disorders.
Thank you, Sarah, and good afternoon. I'd like to start with the mission of the Bureau of Justice Assistance, which is to provide leadership and services and grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. Unfortunately, the slide is not advancing, Sarah. Next slide, please. Great. Thank you. The Second Chance Act, targeting treatment to incarcerated and reentering adults with co-occurring substance use and mental health disorders. Next slide. Amount and length of awards. Applicants must apply in one of 3 categories depending upon their jurisdictional status. Category 1, units or components of state government. Category 2, units or components of county or city or local government agencies serving adult individuals. And Category 3, federally recognized Indian tribes and Alaska Native tribes and/or tribal organizations serving adult individuals. The main highlight with this slide that I'd like to point out is that this project period for this grant program has been changed to a 36-month project period. That's something to note on the 2016 solicitation. Next slide. Targeting adults with co-occurring substance use and mental disorders. Regarding the application process, please refer to the How to Apply in Section D of the solicitation. And other than that, the grants.gov support hotline hours of operation are 24 hours a day, 7 days a week, except for federal holidays. Next slide. Targeting individuals with co-occurring substance use and mental disorders. Again, on the eligibility, this solicitation is intended for states, units of local government, and Indian tribes to improve the provision of treatment in prisons and jails and through parole and other court supervision. And eligible entities must demonstrate partnership with community-based substance abuse and mental health treatment programs to coordinate efforts. Next slide. Approved uses. On approved uses, I'm going to read this slide verbatim, as this is the really important part and very specific to this program, apart from other Second Chance Act programs. Treatment of co-occurring substance use and mental health disorders in prisons and jails. The term co-occurring disorders, COD, refers to the co-occurring substance-related and mental disorders. Clients said to have COD have one or more substance-related disorders, as well as one or more mental disorders. At the individual level, COD exists when at least one disorder of each type can be established independent of the other and is not simply a cluster of symptoms resulting from a single disorder. Providing recovery support services, reentry planning and programming, and post-release treatment and aftercare programming in the community through the completion of parole or court supervision. Next slide. Goals and objectives. The goal of the program is to reduce recidivism by improving functional outcomes for individuals with co-occurring substance use and mental disorders, both pre- and post-release. Under this solicitation, BJA is seeking applications to implement or expand treatment programs for adults with co-occurring substance use and mental disorders during the reentry and community reintegration process, as well as expand and improve the screening and assessment for co-occurring disorders that take place in jails and prisons. These programs should improve the provision of treatment for adults 18 years and older being treated for co-occurring substance use and mental disorders, focusing primarily on post-release programming for every program participant. Next slide. Program design elements, the planning phase. Grantees will receive intensive technical assistance and will be allowed to access up to $50,000 of the total grant award in order to complete and submit a required planning and implementation guide provided by the BJA Technical Assistance Provider, the National Reentry and Resource Center, which will guide each grantee in developing a strategic plan that incorporates evidence-based programs, policies, and practices. Program budget approval and coordination with a technical assistance coordinator is required to complete and submit a planning implementation guide. And the P&I guide must also be approved by BJA. Next slide. So here we have the planning activities, and this can take up to the first 4 months or so of the program. Continued development of the continuum of care model during this planning period, and the program staff will review and plan for the provision of screening and assessment and pre-release treatment and services and post-release programming to ensure that all gaps within the remaining system are filled by strategically targeting grant funds for maximum efficacy. Next slide. We'll continue with the implementation phase. And during the implementation phase, you're going to reach the intended target population with the intended services to know how effective that you are. Establishing a baseline recidivism rate and collect and report recidivism indication data. Provide a baseline recidivism rate specifically for the proposed target population, including documentation to support the development of the rate. Collect participant unique identifiers and collect and report recidivism indicator data. During this time, you'll target criminogenic needs that affect recidivism. While individuals re-entering the community have a variety of treatment and behavioral needs, which are themselves risk factors for future reoffending. Criminogenic needs are the dynamic risk factors most closely associated with offending behavior. Criminogenic risk and needs factors include a history of antisocial behavior, antisocial personality patterns, antisocial cognition, and antisocial associations and associates, families and or marital status, school and or work, leisure and or recreation, and substance abuse. Next slide. And this is the implementation phase continued. These are the next 5 design elements for the implementation phase. I would like to focus briefly on integrated treatment in particular. BJA anticipates funding applicants that demonstrate an integrated treatment approach, knowing that integrated treatment produces better outcomes for individuals with co-occurring substance use and disorders. Without integrated treatment, one or both disorders may not be properly addressed. While integrated care here refers to the range of processes and strategies for combining substance use services and mental health services to address the needs of individuals with co-occurring substance use and mental disorders. Integrated care can also refer to combining different types of services provided by different agencies and systems beyond substance use and mental health, including primary health care, housing, and treatment to address criminogenic needs. There are two levels of integration: systems integration and services integration. Systems integration refers to the process by which individual systems or collaborating systems organize themselves to implement services integration to clients with co-occurring substance use and mental health disorders and their families. Services integration refers to the participation of providers trained in both substance use and mental health services to develop a single treatment plan addressing both sets of conditions, and the continuing formal interaction and cooperation of these providers in merging separate clinical services to meet the individual's substance use, mental health, and other needs. Services integration has two levels. Integrated programs are changes within an entire agency that help practitioners provide integrated treatment and integrated treatment interventions, are specific treatment strategies or techniques at the individual practitioner level and include all services and activities that are combined in a single contact or series of contacts over time. Services integration at a minimum means integrated screening for mental and substance use disorders, integrated assessment, integrated treatment planning, integrated or at least coordinated treatment, and continuing care. Next slide. So we continue with the implementation phase. Let's look at the next 5 elements. Applicants are encouraged to make available and comprehensive range of programs, including services that employ the cognitive, behavioral, and social learning techniques of modeling, role-playing, reinforcement, resource provision, and cognitive restructuring, educational and job placement services, including supported employment, ongoing evidence-based substance abuse, and mental disorder treatment, housing, physical health care services, veteran-specific services as applicable, programs that encourage safe, healthy, and responsible family and parent-child relationships, and enhance family reunification as appropriate, mentoring, and permanent supportive housing. Also, to provide sustained aftercare case planning management in the community, and to plan for data collection and performance measurement to meet grant performance measurement reporting requirements, and plan for conducting process outcomes. Next slide. So priority considerations. Those programs that incorporate innovative uses of information technology which leverage electronic information sharing and communication to advance the specific goals of this solicitation, including but not limited to sharing of electronic medical records, such proposals should clearly state how justice information sharing will be employed to address business solutions using architecture, standards, policy, and technology deployment. Applicants must also demonstrate utilization of DOJ's global recommended specifications and guidelines where applicable, to include implementation of the global standard package. And for more information, you can visit on global information sharing, you can visit www.it.ojp.gov/GSP, that's Golf Sierra Papa. So, priority consideration will be given to programs that focus on geographic areas with demonstrated high need, with those programs that innovate with technology, and those programs that link directly to supportive housing efforts. With regards to technology, please refer to the slide and for global to the website. Next slide. Mandatory treatment requirements. On mandatory treatment requirements, it is important to note that services are clinically appropriate, are in consultation with single state authority for substance abuse services, are being provided by people and entities who are in compliance with all requirements for licensing, and for federally recognized tribes, they must submit a tribal authorizing resolution. Next slide. Selection criteria. So this is the breakdown of the scoring for each section and how it is weighted. And you can see program design is weighted by the largest percentage. Next slide. Statement of the problem. So this is where you talk about the baseline recidivism rate, the method for which you collect it, what level of reduction constitutes success. Provide a baseline recidivism rate in this section, and as I mentioned, the method and the proposed target population that you are hoping to reach, and discuss what level of reduction in recidivism is going to be considered success. If the applicant does not have a baseline recidivism rate for a historical sample of say, individuals similar to the target population, then you would provide a rate for another population. For instance, use a recidivism rate for the X individuals that have been released from a local prison or jail, such as a facility recidivism rate. Make sure to include a description of the type of recidivism rate targeted, such as arrest, conviction, revocation, and/or reincarceration. Also, provide an explanation of the population demographics, risk level, offense type, and the follow-up period length post-release and the date when the recidivism rate was calculated. Next slide, please. Program design and implementation. The bullet I would like to highlight here is addressing the 16 program elements. That's going to be really important in the design and the implementation of your program. Next slide, please. Program design and implementation continued. The important points here are the total people to be served over the project period. If the program is already operational, how many people has the program served, similar to the target population, over the last 6 months? Next slide, please. Capabilities, competencies, and coordination. This is worth 25% of the overall application, and this is where you must describe to the reviewer your infrastructure, staff experience, and strong partnerships for a successful program. Next slide. Plan for data collection and performance measurement to meet the grant performance measurement reporting requirements and plan for conducting process outcome evaluation. Last year, it was a priority consideration for data collection, and this year, this is a piece that's new in 2016. Data collection is mandatory this year, and this is new. The plan for conducting process outcome evaluation is considered to be 15% of your application. Next slide. Impact outcomes evaluation and sustainment and plan for collecting the data requirements for the solicitation performance measurement. On this slide, I would like to highlight the last 2 bullets in particular. where it begins, outline what data and information will be collected and describe how evaluation collaborative partnerships will be leveraged to build long-term support and resources to sustain the project when the federal grant ends. So regarding the data and information to be collected, since this year, data collection has become mandatory, and the thought behind that is to help programs to make a plan for sustainability. And making the data collection mandatory was made in part to help programs use the data and outcomes to help sustain their programs. So be thinking that way as you set this part up. Next slide, please. The budget. Okay, so as far as the budget goes, my biggest piece here is to, and biggest piece of advice, I guess you could say, is to make the budget make sense. Your costs should parallel your budget categories and the costs associated with the grant activities and the budget categories. They should all parallel one another. What's spoken about in the narrative should follow the budget narrative and then also be found in your budget line items, and they should all flow together. Next slide. So for contact information regarding the solicitation, your best avenues for assistance would be technical assistance, would be grants.gov and NCJRS. They are the best equipped to answer 99% of your questions. They've been doing this for quite some time, and they do collect all of the questions from past application processes, and they have them in a database. So they're very, very well equipped to answer most questions. Thank you so much for your attention. Sarah?
Thank you so much, Maria, for running through those requirements for the reentry program for adults with co-occurring substance use and mental disorders. Just a reminder to all the folks who are listening in, there is a question and answer chat box on the lower right-hand corner of your screen, and if you have any questions for Maria, please type them into that chat box, and we will begin asking the questions now. So to begin with, the first question was, is the webinar being recorded, and will the PowerPoint slides be available? And the answer is yes, the webinar is being recorded, as we mentioned at the beginning of the webinar, and you will be sent a link as a registrant to the webinar, and we will have the slides available online as well for a reference point for you moving forward. Okay, so the next question is, what is the review process? How do sites get selected to be a part of this cohort of grantees? Are you able to field that question?
Can you repeat that question for me, Sarah?
Sure. The question was, what is the selection process for deciding on how the grantees get selected? So what does the review process from BJA look like?
Sure. So we actually have peer review panels that are set up through a contract provider, and the peer review panels are subject matter experts that come from the field, and they are subject matter experts in behavioral health, from corrections background, as well as researchers and academics, and tribal as well. And they are reviewed, and each year we get a pool of reviewers, and only peer reviewers that receive a favorable evaluation are invited back. So we screen them for their subject matter expertise and make sure that each panel is set up with behavioral health and criminal justice and academic component. and they actually read through all their assigned applications, and if they have anything to discuss, they come together and they discuss any questions that they have after they've submitted their scores. If there's a variance that's greater than 3.5 between reviewers, then they do come together on a consensus call to try to reach consensus. They don't have to reach consensus, but we give them the opportunity to discuss that. I monitor those calls. I don't participate in those calls. And then their final scores are submitted to our contract to assist us and submit those to BJA. I hope that answers it.
Thanks so much, Maria. It seems like a thorough answer. So the next question we have from one of the participants is, do indirect costs come from the total award, or are they added on?
I guess I could feel that question. Indirect costs are costs that can be incurred as you manage your program. They are allowable, but your budget has to be approved. So indirect costs, I guess I could say, are allowable. There is not a dollar amount, but it must be approved by your program staff.
Okay, thank you, Maria. Yes, when you submit an application, you would also submit a budget that would have a comprehensive layout of things like indirect costs. So one example of indirect costs that some sites have might be benefits for their staff. So if they put a staff position on, it might be benefits, and you would indicate that in the budget is what is typically seen in that piece. Okay, the next question is, can funds be used for wraparound services such as housing, job placement, co-occurring mentorship programs in addition to mental health and substance use treatment?
That one to me, Sarah?
Yes,
Okay.
I think either one of us can answer that. The answer for that is yes, a lot of programs use it for those services. Maria, did you have something to add on that?
Oh, no, I was just going to agree with you. Absolutely. That's how programs are successful in reentry efforts is oftentimes through lots of wraparound services and partnership. Thank you.
I think the important thing to remember, although, there's a lot of stuff in treatment in the solicitation, recovery support services are an important part of the continuum of care when it comes to substance use and mental health services. Okay, the next question for Maria is it required that the 300 hours of individual cognitive behavioral therapy be manualized?
I'm not sure I understand. The 300 hours, is it mandatory? Or is it manualized? I'm not sure I understand.
Okay, I think I can feel that.
Okay.
So within the requirements, there's one section that lists the dosage. So the research shows, 100 hours of dosage for low risk, 200 for medium to moderate risk, and 300 for high-risk individuals. There's another piece of the requirements that says, recommends cognitive behavioral therapy as well as motivational programming. There isn't anything specific in the solicitation that requires that treatment to be manualized, although evidence-based practices are encouraged.
Thank you, Sarah.
You're welcome. So the next question is, can a nonprofit participate in this grant if we partner with a jail or prison?
The answer is yes.
And that is actually a very common thing that we see is partnership to be able to provide the services to do in-reach into the facility. Okay, the next question is, clarify if tribal resolutions are required. In one place, the type of authorization document for a tribe is determined by the tribe, but the presenter said that a resolution is needed from tribes or in connection with mental health treatment.
Yes, it is required. And it would have to be a federally recognized tribe.
Okay, thank you, Maria. Okay, the next question is, if you are working at an academic institution that indirect costs are usually added onto the award, in this case, would they come from total award or would they be added on? Some academic institutions have up to 54% indirect costs. So, Maria, I'm not sure if we're able to answer that or whether we would want to direct them to one of the technical assistance lines for that.
Yeah, yes, I would say so, because I think that would take a little more time. Yes, I would think that would be the best for that question.
Okay, so we'll make sure to provide that individual with that information due to the specificity of the question.
Yes.
Another question we have is vehicle leasing for service provision allowed?
In that circumstance, I would refer the person to the federal financial guide. In general, vehicles are not an allowable use of funds. The way they said a lease of a vehicle, I don't believe so. I would definitely check the federal financial guide on that.
And the federal financial guide is actually linked to in the solicitation, so there's a link directly available if you open the solicitation. Okay, so another question we had is one individual was curious as to how many people registered for this webinar, and I can indicate that 147 people registered for the webinar for your reference point. Another question is a question about family-centered treatment. It says, what about family-centered treatment, including spouses and children in educational therapy or behavioral therapy? So I think they're asking, is that an allowable use of funds?
Yes, I would say it was allowable use of funds as it's considered best practice. And Sarah, I would defer to you on the the type of therapy, if there's any other detail you wanted to add around that.
Yeah, so there are programs that do have some family-centered services related to these, and that certainly we have seen that in work both in the facility and in the community. And as far as the programming specifically, that would depend on what your jurisdiction is looking for, but certainly would want you to look at evidence-based programming available for family as well as children who have parents involved in the justice system.
Thank you.
Okay, the next question is, does the agency have to serve reentry clients with mental health or substance use issues only?
The answer is this solicitation is specifically for adults with co-occurring substance use and mental health disorders. So it is a very specific program for that target population.
And if that individual is from a different type of service provider, there's also other solicitations that we mentioned at the beginning that are available, such as comprehensive mentoring, smart supervision, and technology and careers. On the flip side of that, if it's a reentry program that provides mental health, substance services, and additional services, that also seems like it would fit into this. The next question is, does the applicant need to have a risk needs tool in place prior to applying for the grant?
I believe that is an allowable activity under the planning phase. Sometimes it's being developed, or you're trying to determine what is going to be the best risk needs assessment to use. And Sarah, I'll let you comment on that a little bit further.
Yeah, that's correct. So it does indicate an actuarial-based assessment as one of the requirements in the solicitation. So oftentimes grantees do indicate that they're going to begin a risk assessment tool, or they'll indicate a specific tool that they'd like to implement. And then through training and technical assistance, can also get some assistance on best practices for how to implement a new risk assessment tool. Okay, the next question is, so going back to the questions on the tribal resolution, so is that tribal resolution required at the time of the proposal submission?
Yes, I believe it would need to be attached to the application in order to be eligible.
Okay, thank you. Another person asked for the technical assistance phone number for the questions, and so I brought back up that slide with the contact information. So there you can either contact grants.gov, or you can contact the National Criminal Justice Reference Services, and the toll-free number is 1-800-851-3420. Okay, the next question is, could we use two different assessment tools to see which fits best for tribal clients in the first year and then pick one in the remaining project period?
I'm going to leave that to the technical assistance provider, Sarah.
I think, you know, if you're one of the folks selected and that was how you laid it out in your application, then it certainly would be possible to do that and to look at which one would work better, particularly knowing some cultural competency issues with risk assessments related to that population as well. Okay, the next question is, I think for you, Maria, which is, can a jurisdiction count HUD or CDBG funds as a match?
The rule with match is that you can match federal funding with state or local or foundation or private, but you can't match federal monies with federal monies. So that's kind of the rule there. So you have to look at the source of where the match is coming from.
Okay. So,
or in kind as well.
Great. So the follow-up question they had is state agency housing funds as a match, and it sounds like because that isn't federal funding, that could be used as a match. Is that correct, Maria?
Yes. If it's state funding, then it could potentially be used as a match. But if it's federal funding, it cannot.
Okay, great. Thank you for that clarification. Okay, so the next question is related to the planning and implementation guide. That's a question. The question is, what's what is in the planning implementation guide and what does the process look like for that guide. I think, Maria, I will be able to field this one. So the Council of State Governments Justice Center, as the National Reentry Resource Center, developed a planning and implementation guide, which is linked to within the solicitation in conjunction with the Bureau of Justice Assistance. And the outline for it really details key things in the planning phase in order to get you ready for implementation. So that includes what your partnerships and stakeholder groups look like, screening and assessment, service provision, data collection, questions about healthcare enrollment, connections to benefits, as well as sustainability. So those are the major categories for that, and the technical assistance provider will work with the grantee to go through the exercises and make sure they have a great plan in place. And then once the planning and implementation guide is submitted to BJA, the funds for the implementation would be released. Okay, so again, if you have any final questions, please put them in the question and answer box at the lower right-hand corner. So we are not seeing any additional questions, so we want to thank you for joining the webinar and encourage you to contact the technical assistance from grants.gov and from the National Criminal Justice Reference Services for further information. We will provide the recording of the webinar online, which will be sent to you as a registrant, as well as the PowerPoint slides. Thank you so much, Maria, for providing all this information on the application process.
Thank you to everyone for attending.
All right, have a great day.